नमस्कार दोस्तों, मैं डॉक्टर अनिल कुमार, फाउंडर एंड प्रेसिडेंट हेल्थ केयर स्किल्स फाउंडेशन। मैं बहुत दिनों से ये चीज़ नोटिस कर रहा था कि जो हमारे स्टाफ, हेल्थ केयर वर्कर्स, नर्सेस, टेक्नीशियंस, एलाइड हेल्थ केयर वर्कर्स, द अमाउंट ऑफ एनर्जी दे पुट इन टू सेव लाइफ्स, amount of process, amount of care they are involved into. But most of the times I feel they have been neglected about the services. To an extent, COVID has bring lot of limelight about the nurses, about the healthcare industry. Also, it has created lot of awareness about the healthcare services, what a patient need and what a nurse, what a healthcare provider is doing to save health of people in community at large. So I take privilege and honor to share a few words about the nursing profession and the nurses, what wonders they have been doing over a period of time. And it is for us to recognize them and to take them to a larger pride and prestige, to highlight what they have been constantly doing to encourage and to save life and to create a healthy environment around. So I really feel what a staff, nursing staff at bedside is doing is one of the most remarkable services one can think of. The way they have been taking care of each and every patient as to improve the outcomes, as to meet up all the concerns related to that particular patient. It actually involves a huge amount of courage, skills to take care of such a big noble profession. So my big regards to all the nurses, to all the healthcare workers who have been doing hard and working hard to improve the healthcare standards. I have prepared few things for the nurses. I count them as one of the most noble profession one can think of. So I call each nurse as a guardian of life, because a nurse is actually dealing with the closeness of the life, the severity of the illness. A nurse at bedside is able to pick small subtle changes. It's actually life-saving skills what a nurse can help patient to sustain life. So that is why I call them as guardians of life. They have unwavering commitment toward the patient care. They work in long shifts, they work in day shift, night shift, rosters, lot of pressures, handling difficult patients, handling sick patients, handling difficult families. So lot of commitment is from each and every nurse in improving the healthcare standards. There is also a pressure for each and every nurse about the continuous learning and skills enhancement, because as we are moving with technology and science, each and every nurse has to upgrade its skill to meet up with the increasing technology and demands to improve the healthcare delivery and to provide better care to these admitted patients. And I feel each and every nurse is very compassionate in their shift, in their every moment, the way they deal with the patient, that they deal with the patient's need, that they take care of the patient's small issues is absolutely remarkable. And I feel over a period of time, each and every nurse is a master of communication. They do understand what family expects, what are the basic needs of a patient admitted to intensive care or emergency. Each and every nurse also has to adhere to policies, adhere to documentations of each and every organization. These policies and documentation is also important to improve the quality of healthcare services as well as to improve the standards of healthcare delivery. Each and every nurse, to my understanding, is very precise in difficult scenarios, in difficult pressure-bound scenarios and situation. So that also remarks a huge amount of courage and understanding to do everything, one of the best things in even difficult situations and difficult pressures. Each and every nurse have been handling griefs with lot of grace, because most of the times in intensive care we don't expect one by one result. There are morbidities, there are mortalities, there are difficult situations when a nurse is actually involved in the grief of the family as well as with the patient, in the process of declaring death, then winding up and handling the dead body to the family or to shifting to the mortuary. So it's a very close call. So we are actually seeing the different emotions of the family, how to deal with it. So that's also a difficult part which a nurse is going through in the intensive care or emergency practice. So that also requires a huge amount of courage. It also requires huge amount of resilience from each and every nurse to handle such difficult scenarios. There is a lot of emotional and mental resilience what I can see from each and every nurse, because there are a lot of emotional breakdowns, mental challenges, because dealing with that critical aspects in emergency and trauma or critical care, definitely our nurses has to be emotionally strong, mentally strong to take care of such difficult scenarios in critical care areas or palliative care or emergency scenarios. So again, huge regards for keeping up the balance of emotional and mental resilience for all the nurses. And I feel as all nurses work in shift, work as a team, there's a unit or there is a team of nurses, team of technicians, doctors, allied workers working towards a similar goal. So team dynamics, team support is also an integral part which I feel each and every nurse should imbibe in. And also it also plays a big regards to all the nurses, all the team leaders, the nursing in charges, the nursing faculties, the tutors, the administration in overall development of this team building and the support towards the better delivery of the healthcare services. And I also feel each and every nurse has to update with the technology, has to update with electronic medical records, documentation in EMR format, utilization of computers for indents, maintaining records, maintaining integrity, maintaining documentation, handover process. So everything is now changing over with technology, central monitoring, remote monitoring, tele-ICUs. So a lot of things have developed over a period of time where nurses are also empowered to take care of the growing needs of the healthcare industry. This also is an important integral component to improve the quality and standards of healthcare delivery. And at last, I feel big regards to all the nurses for what they have been doing over a period of time. Their services are tremendous, their efforts are tremendous, and I feel they have been the unseen heroes of the healthcare industry. So my request to all the doctors, all the senior faculty members, administrators, in charges, nursing faculty, DNS, nursing superintendents, or the principals, deans of various organizations, nursing colleges, hospitals, corporate world, to encourage and to support and to bring these unseen heroes into the limelight, because what they have been doing is one of the most marvelous achievement. And if they are working, that is what we are seeing the results. We are seeing the happy families, we are seeing the happy patients, and we are actually seeing the improvement in the healthcare services. So huge regards to all the nurses for their support and the wonderful delivery towards the improvement of healthcare to community at large. So I again, big thanks and regards to all the nurses, and I wish best of luck for all their future endeavors. Continue to learn hard and continue to do best in your life. Maintain your healthy balance, emotional well-being and mental well-being. That's how we have to continue with the team dynamics to improve the healthcare world. Thank you.